Hello, I'm Chelsea King. I am the Executive Director of the Oregon Health and Education Collaborative, and I am here today with a conversation with a board member, Dr. Greg Blaschke. Welcome, Dr. Blaschke. Thank you so much for making time to have this conversation today. And just by way of introducing you to the people who are watching this video, Dr. Greg Blaschke is the Shirley R. Hughes Professor and Division Head of General Pediatrics at Doernbecher Children's Hospital at the Oregon Health and Sciences University. So I was hoping you could just tell us your understanding of Heckman's curve. What's compelling about it to you?
Children are maybe 10 to 15 cents out of every dollar of healthcare spending. The vast majority of healthcare costs are really with adults and elderly folks. But children, even though they're only 20% of the population, they're 100% of our future. They're 100% of the people who will be paying into Medicare and Medicaid for the rest of us that are starting to age. We also think about kids. Approximately 50% will be on Medicare or Medicaid at some point during their childhood. We know in Oregon that approximately half of kids are born on Medicaid. And if we look even at Doernbecher Children's, I think it's right around 55% of kids cared for at all at Doernbecher have Medicaid funding paying for their care. And so all of these things combined basically lead to a statement that you could sort of think about. Sometimes children are born into suffering, and that can continue for a lifetime. Or the flip side is if we're investing upstream and reducing that suffering and helping children to succeed, essentially there'll be increasing return on investments. And what Dr. Heckman did, Jim Heckman from the University of Chicago, primarily economic Nobel laureate, I think in 2006, basically he looked at all the investments in healthcare and education, and then looked at that over time as to their return on investment. And essentially in the first 1,000 days from birth to 5, I think the current data is that essentially there's $17 returned for every dollar invested in birth to 5. And I guess the other thing I would say, that curve sort of became even somewhere in adolescence, where in other words, every dollar invested would not result in $1, but somewhere less than $1 in return. But what Dr. Heckman talks about is essentially, he looks at it as compounding interest. So every dollar that we invest in the first year of life, if that helps children be healthy and well and ready for preschool, there's some return on investment there. And then if those children go through K through 12, able to learn, ready to learn, they'll be better prepared to be college students, perhaps, or succeed in a vocational area that they have strengths in and be contributing members to society. So I think all of this relates to what we're trying to do at the Health and Education Collaborative. It is trying to take some of those dollars and invest them further upstream so that we can ultimately reduce the cost to Oregonians a decade or two down the road.
And I was wondering if you could just speak for a moment about, just from your experience and your background, what is so important about that focus on the first 1,000 days, this upstream initiative?
You can also think about epigenetics and things that Native Americans have gone through. There's also the minority stress experience, which is sort of what I can say sort of relates to me as a gay male physician, right, was all that sort of unconscious and societal repression of something that really wasn't accepted when I was growing up. And that's changing, and that's a good thing. And I think that will help that population as well. So I'm hoping the collaborative can find groups of people who are already starting to work in areas and groups of people who are already at a disadvantage in Oregon. We want all kids to thrive. But again, as a pediatrician, I see the future, and I see more and more patients in my office who don't speak English, maybe Latino, or maybe immigrants from different parts of the world, who, if we don't get them off on a good start, it's not going to be the same as maybe Irish immigrants from my predecessors many decades ago.
Yeah, and you're really pointing to what we see is an opportunity gap for these populations, and if we're going to change the outcomes, and we need to change that the opportunities available.
Agree.
Yeah, and
I think that's also related to Heckman. I mean, some people also counter that we have something that, in theory, we sort of talk about differential well child visits. That someone who maybe is not economically disadvantaged, who has two parents at home, already has siblings, and speaks English, doesn't have any disadvantages. Do they need the same kind of well child visit as someone whose parent, might be in prison, or speaks a different language, has difficulties in school because of bilingual or other things, other social determinants of health? And I'd like to think that Heckman sort of looks at all investments at all ages. And so some people think that what's missing is sort of the focus on who needs a leg up versus, people who may not really need anything special. As a pediatrician, I see kids who are in houses with substance use disorders. I'm sure I see some kids who have substance use disorders, but I have learned a lot from my internal medicine and family medicine colleagues, and how much housing and substance use disorders and behavioral health disorders sort of all travel somewhat together, and you need to address all three simultaneously.
I think that's really what this Upstream initiative is aiming to do, is to work in a community-based, culturally responsive way to come up with some solutions to fix that siloed, fragmented nature, because we do know we need to treat and serve the whole person, the whole family, and address
really the whole community too.
The whole community. Yeah. Well, I appreciate so much your time today, and just all the years that you have put into getting to the place where you are in your career, and all the lives that you have touched along the way as well.
Lots of work to do.
Yeah.
Lots of job training to replace those of us who are getting on in years and ready to pass on to the next generation, new ideas and new solutions. So I think this is a good opportunity to maybe bring some of those forward.